Could my hair loss be related to a medical condition like thyroid or anemia?
So hair loss can absolutely be related to medical conditions. When I look at patients, I need to know every medical history that they have. A lot of people assume that just having a thyroid imbalance can lead to stress-induced shedding, but there's a lot of other causes as well. Hormonally, not just thyroid, we have estrogen and the testosterone connection. Estrogen, especially for women, is going to help your hair. Estrogen does about 300 positive benefits for a woman. So what commonly happens is when women go through their perimenopause or menopausal phase, the estrogen levels not only go down pretty low, but they go down very rapidly. With testosterone, it tends to not drop at the same intensity. So now the ratio of testosterone to estrogen is off, and it tends to make testosterone more concentrated. Once that happens, and we know that testosterone converts to the hair-killing hormone DHT, a lot of women will not present with genetic hair loss until they've hit their 4th, 5th, or 6th decade. It can absolutely happen younger, but most women will not begin to see their genetic hair loss pattern happen until there's a ratio shift between their testosterone and estrogen.